talk about hernias. What exactly are they and how often do you see them?
Well, hernias are very common. We see hernias, about 1 million hernias are repaired a year in the U.S. And hernias are seen in everyday practice. No matter what type of physician you are, you're going to see them. Of course, in my area of expertise as a specialist, I see a lot of hernias. And the simplest way to understand a hernia is it's a hole. I tell our students that think of hernia H, whole H. Hernia is a hole. It's just a hole in your abdominal wall or in your groin where your insides are protruding through that area.
And it's painful.
It can be painful.
That I know.
It can start with some discomfort, and then it can progress to pain, of course, with strangulation. We'll talk about that in a little while. But of course, yes, you can have really, really bad pain with hernia.
We have a 3D image of an abdomen, and doctor, I'd like you to walk over to our 3D wall, and this will kind of help you understand where it's located and what exactly is happening in the abdomen. So take it away, doctor.
Yeah, so what you have here is an image of the abdominal wall. You have the musculature of the abdominal wall. We're going to be talking about groin hernias, which occur down here in the inguinal groin location. We're going to be talking about hernias that occur in the belly button, which is the umbilicus, and hernias that occur after surgery as well, which is incisional hernias. And as you peel away the abdominal wall, and you can see that as the abdominal wall goes away, then you definitely will see what is the layers of the abdominal wall, and then eventually you see the insides of the patient, and that's what is protruding through the hole.